The COVID-19 pandemic reshaped the world. It disrupted economies, claimed millions of lives, and forced humanity to reconsider its priorities. But what if we faced something even worse? A pandemic more contagious, more deadly, and more disruptive than COVID-19. Could we survive it? Let's explore this daunting possibility. The fragility of human life. Pandemics have been a constant threat to human life. From the Black Death in the 14th century to the Spanish flu in 1918, history is riddled with moments when humanity came face to face with its mortality. The COVID-19 pandemic gave us a sobering reminder of our vulnerability, but what if the next pandemic makes COVID-19 look mild by comparison? While many believe the worst is behind us, the reality is that the possibility of an even deadlier and more contagious virus emerging isn't science fiction. It's a matter of when, not if. This script will delve into how well prepared we are for such a catastrophic event, the scientific and medical advancements that may help, and what the consequences might be for human survival. The scale of past pandemics and COVID-19's lessons. Let's first look at how past pandemics have played out, and why COVID-19 is a warning, not a one-off disaster. The 1918 Spanish flu, for instance, infected about 1/3 of the global population and killed an estimated 50 million people. It was lethal, swift, and widespread. Compare this with COVID-19, which to date has caused approximately 7 million deaths globally, according to WHO data. The difference in mortality isn't just because the virus was less deadly, it's also because of the unprecedented speed in which vaccines were developed and deployed. However, what made COVID-19 particularly alarming was its adaptability. Mutations like the Delta and Omicron variants showed just how quickly the virus could evolve to become more transmissible. But what if the next virus mutates not only to spread faster but to also evade vaccines and treatments? This potential future is not as far-fetched as it sounds. The biological threat of a supervirus. Imagine a virus with the airborne transmissibility of measles and the lethality of Ebola, which has a mortality rate that ranges from 25% to 90% depending on the strain. While COVID-19's case fatality rate hovered around 1–2%, imagine dealing with a pathogen that has a fatality rate of 20%, 30%, or even higher. One potential candidate for a future pandemic could come from zoonotic diseases, those that jump from animals to humans. Roughly 75% of emerging infectious diseases in humans are zoonotic. The next global pandemic could arise from a mutation in a virus we're already familiar with, avian flu, for example, or it could come from something we've never seen before. The question is, are we prepared? Medical preparedness. How ready are we? After COVID-19, one would assume that the world is better prepared for the next pandemic. Governments have stockpiled personal protective equipment, PPE, bolstered healthcare systems, and invested heavily in vaccine technology. However, beneath the surface lies a more troubling reality. The World Health Organization has warned that many nations remain woefully underprepared for another global pandemic. In fact, a 2021 report by the Global Health Security Index found that not a single country was fully prepared for a pandemic, even after the COVID-19 wake-up call. The report gave the US, the UK, and other major nations low ratings in key areas like health system strength, risk communications, and political will. Global vaccine inequity. One of the harsh lessons from COVID-19 is the stark disparity in vaccine distribution. While wealthy nations received vaccines early and in large quantities, many developing countries were left to scramble for limited supplies. If a pandemic far worse than COVID-19 strikes, this disparity will likely deepen. What if the next pandemic spreads faster than we can produce vaccines? It's estimated that global vaccine production capacity is about 5 billion doses per year. But in a world of 8 billion people, that leaves a massive shortfall, especially if the virus requires multiple doses or if large parts of the population are left without access to vaccines due to geopolitical conflicts or manufacturing delays. We saw vaccine nationalism during COVID-19, and the consequences were severe. The role of mRNA technology. The one silver lining in the pandemic response was the rapid development of vaccines, particularly mRNA vaccines, which allowed for faster adaptation to new variants. In theory, this technology could be a game changer for future pandemics. It can be adapted to different viruses in a matter of weeks, and large-scale production can be ramped up quickly. But the promise of mRNA technology is not without its challenges. Scaling up global production requires cooperation between governments, pharmaceutical companies, and international bodies like the WHO, something that, as we saw during COVID-19, is easier said than done. The reality is, mRNA vaccines are only as good as the systems in place to distribute them. Healthcare system collapse, a likely scenario. Even during COVID-19, healthcare systems in some countries buckled under the pressure. ICU beds were filled beyond capacity, and doctors were forced to ration care. Now, imagine a virus that not only spreads faster but also has a higher mortality rate. The healthcare system would collapse even faster, particularly in nations with weaker health infrastructures. The CDC reports that the US alone had over 1 million excess deaths in 2020 and 2021, deaths that were attributed not just to COVID-19 but also to overwhelmed healthcare systems and delays in treatment for other conditions. In a worse pandemic, those numbers could skyrocket. Even in developed countries, healthcare professionals would be faced with impossible choices about who to save and who to let die. Economic fallout, a catastrophe beyond imagination. COVID-19 caused an estimated $16 trillion in economic damage globally, according to the Congressional Budget Office. Entire industries like travel, hospitality, and retail ground to a halt. Now, consider the economic impact of a pandemic that kills millions more and triggers even longer lockdowns. Economists warn that a more severe pandemic could push global debt levels into unsustainable territory, leading to widespread economic collapse. Supply chains would disintegrate, leaving countries unable to import essential goods like food and medicine. The world witnessed shortages of basic items like toilet paper and masks during COVID-19. A worse pandemic could trigger shortages of far more critical supplies, including food and water, leading to mass unrest. In fact, research published in the journal Science in 2020 estimated that global pandemics could cause an average of $500 billion in annual economic losses going forward if better preparedness isn't implemented. Social unrest. The ripple effect. Pandemics do more than kill people, they disrupt societies. COVID-19 exacerbated existing inequalities, led to a rise in mental health issues, and sparked protests worldwide. In the US, pandemic-related job losses disproportionately affected lower-income workers and people of color. A more catastrophic pandemic would likely see these social fissures explode into full-blown unrest. Food shortages, healthcare rationing, and unemployment would lead to mass protests, and in some regions, perhaps even civil wars. The psychological toll of long-term isolation, fear, and grief would exacerbate mental health crises. Some experts have pointed out that the world's mental health epidemic may, in fact, be the next pandemic we have to contend with. The role of technology in survival. Could technology save us from a worse pandemic? Artificial intelligence, big data, and genomic sequencing have all been hailed as tools to better predict and manage pandemics. AI models were able to track the spread of COVID-19 in real time, and some governments used big data to identify hotspots and allocate resources. But technology isn't a panacea. The deployment of tech solutions is often hindered by privacy concerns, regulatory red tape, and unequal access. Only 60% of the global population has access to the internet, and large parts of the world still lack the infrastructure to implement these advanced technologies. That said, advances in telemedicine, digital health monitoring, and AI could offer some hope in managing healthcare resources more efficiently. Imagine a world where hospitals could predict outbreaks days in advance, or where remote doctors could diagnose patients via AI-assisted platforms. The problem? Such systems are still years, if not decades, away from widespread adoption. Controversial solutions: herd immunity, social control, and population limits. One controversial topic during the COVID-19 pandemic was herd immunity, letting the virus run its course to achieve population-wide immunity. While this approach was heavily criticized for COVID-19, it may re-enter the conversation during a more severe pandemic, especially if vaccines and treatments fail. Another controversial issue is government surveillance and social control. China implemented some of the most stringent lockdown measures globally, including using drones and apps to track people's movements. If a more deadly virus were to spread, we could see governments ramp up surveillance to unprecedented levels, raising ethical questions about privacy and freedom. Finally, some experts have pointed out that the world's population may be too large to effectively manage a future pandemic. Overpopulation contributes to the ease with which viruses spread, particularly in urban areas. Some epidemiologists argue that in order to survive future pandemics, we may need to rethink population growth strategies and urban planning. Will we survive? The reality is grim. A global pandemic worse than COVID-19 could bring the world to its knees, disrupting societies, economies, and healthcare systems in ways that we can't even imagine. However, humanity is resilient, and the advancements in technology, medicine, and global cooperation offer a glimmer of hope. But here's the hard truth: surviving the next, more devastating pandemic will require a complete overhaul in how we approach global health. Governments will need to cooperate on an unprecedented level, healthcare systems must be fortified, and vaccine production and distribution should be revolutionized. It will also require sacrifices, both in terms of personal freedoms and societal expectations. In the end, could we survive a global pandemic worse than COVID-19? The answer is, only if we are willing to learn from the past, innovate for the future, and make difficult decisions in the present. Anything less, and the outcome may be far more catastrophic than anything we've ever experienced.